Hello again, beautiful parenting genie community. It's Constance, your lactation consultant, back in the car tonight. I'm so sorry, I had such a busy day and working, and so I actually wasn't able to prepare you a topic. However, I have just attended a conference, a 2-day conference. Now, you remember last week I also talked to you about a conference, an online conference that I've been doing, which is still in progress. But on Monday and on Tuesday, I did actually attend a conference in person. And I was so absolutely thrilled to listen to the keynote speaker. Her name is Professor Helen Ball. She is from England and she's done a lot of sleep studies on babies, in particular, also in relation to bed sharing and co sleeping. And so, because I wasn't able to prepare you something, I just want to tell you this book came out by Professor Helen Ball about a year ago, How Babies Sleep. And it's not for healthcare professionals necessarily. It is actually written so that parents can read it too. And it's fascinating because Professor Helen Ball is not a medical professional, not a midwife, not a lactation consultant. She is an anthropologist. So she studied infant sleep in cultural norm and also in the history of infant sleep. And so, what we have done in our Western society in the last 200 years is quite uh, astonishing. And I've learned a lot. I can't share everything with you tonight, but I thought because sleep is such a big topic for new parents because it's lack of sleep. And there is this huge focus on how we're getting our babies to sleep that I thought I just read you a little bit from one of her chapters. I hope you're happy with that. And I promise you that next Wednesday, I will have a prepared topic for you again. But you might actually like listening to what I've got to say. So, as we know, it's important for babies to get as much breast milk as possible and to feed as frequently as possible because that increases the milk supply and builds a good milk supply for the mother. And of course, we know that babies need to feed day and night, and babies are not born with what is called a circadian rhythm. So for them to adapt to our rhythm takes a while, takes months. And so I'm just going to go through a few little things in this book, and I hope that it helps you because we don't need to teach babies to sleep. They know how to sleep, but they can't sleep in long intervals because they need to feed. And if they didn't feed, then that would also cause problems for the milk supply. And so we've been taught to not have our babies in bed with us. And there's a reason for it in some ways, because for some babies, and for some parents, it's probably not always the best solution to bed share. But for the majority of babies in this world, they do actually sleep with their parents. And if we do it safely, and there are uh, guidelines how to do safe bed sharing or co-sleeping, and I will go through that next week or the week after, then that gives the mother more sleep, the baby more sleep, and also the whole family more sleep if there's siblings. And the sleep studies that were done have actually shown that mothers get more sleep if they do bed share. Anyhow, I'm just going to go through one of the chapters. It's called Frequently Asked Questions. New parents are often puzzled about whether they should be actively doing something to help their baby fall asleep. There are many things we could do, but the role of parents isn't really to teach babies how to sleep. Babies are born knowing how to sleep, but rather to remove the obstacles that stop them from sleeping. And in this book, there's often the talk about sleep pressure. That means we want that baby to really be quite tired. The buildup of sleep pressure triggers sleep onset, and that happens in us adults as well. But it can only work when we are in a relaxed and receptive state, not when we are anxious, afraid, or agitated. If we can help our babies and ourselves to achieve a calm and relaxed state, sleep will happen easily when sleep pressure is high. So, how can I help my baby to sleep? For most adults, eating a good meal is an effective soporific, and this is also true for babies who frequently nod off while being fed, assuming that feeding is a calm and relaxing activity for them. If there are feeding problems, then it may not be, and these need to be addressed first. And there's also psychologists who are they are caution against allowing babies to fall asleep while feeding, as this may cause an association between sleeping and feeding, which means the baby will always need to be fed to sleep. This is unlikely if babies are encouraged to relax and drift into sleep in a variety of different ways. All around the world, parents regularly use feeding, massaging, cuddling, stroking, walking, rocking, and swaying to calm their babies so that sleep pressure can take hold. We could equally say that all around the world, babies use contact with and movement by parents and other carers to help them relax and allow sleep pressure to tip them into sleep. If you experiment with that, what helps to calm and relax your baby, often this is holding them, feeding them, making them feel safe and warm, and offer them opportunities to fall asleep in multiple ways and places. You will be making your life easier by not having to be tied to the same place, doing the same thing for every nap or bedtime. Example, not making a rod for your own back, it says in brackets. And if your baby becomes familiar with multiple people calming and relaxing them in different ways from an early age, so much the better. And that is exactly what we should be doing. We should have the village when it comes to raising a child or children or a family. But it is very difficult in our isolated households these days. Anyway, so the next paragraph is, does my baby need a regular bedtime? The first month, when most babies sleep most of the time, and you know what is interesting? The baby's sleep hours in a 24-hour clock are as diverse as you cannot imagine. Some babies only need 8 hours sleep, and some babies sleep 20 hours, and it's all within normal range. So during the first month, when most babies sleep most of the time, a regular bedtime and pre-bedtime routine gives structure to the day, but mostly for the parents and other family members. Babies developing circadian rhythms is influenced more by a regular wake time than a fixed bedtime. And there is no ideal time for babies to begin their nighttime sleep. Only cultural conventions. Ideal is relative according to what parents are intending to achieve. If the baby's sleep pressure is not high when parents begin the bedtime process, Then they could find themselves stroking, walking, rocking, and swaying for ages before their baby is able to fall asleep. This is one of the pitfalls of insisting young babies, young babies, have a fixed bedtime. What happens if a baby's biology is not ready for sleep at the time you've decided on or have been told is when your baby should sleep? You might spend a very long time implementing a shush and pat routine that gives you a sore back from leaning over the cot, when all you are really doing is passing time waiting for your baby's sleep pressure to rise. Or worse, you might spend days trying to create and implement the perfect nap schedule and optimized wake windows to ensure your baby is ready for bedtime on schedule. I see this picture described repeatedly on social media by exhausted parents who have been persuaded that it is their job to manage their baby's sleep patterns, but are finding the whole thing impossible due to the unpredictability of life. They are miserable and feel like failures. Does that ring a bell for you? Whoever you are who's watching this video? It certainly rings a bell to me. Brings back memories of my own mothering. A key component to get your baby into a sort of the sleep rhythm is to empower parents to experiment with potential solutions and figure out which ones work for families, with an understanding that anything that works now may well need to be altered over time as babies mature and parents need change. Persisting with an approach that isn't working for you and your baby because it is in vogue or recommended by an influencer, expert, or clinician is a recipe for misery. Seek out another opinion that you are all more comfortable with. And then I'll read you one more paragraph and then I'll let you go. What if my baby just won't go to sleep? In this scenario, where babies are simply not ready for sleep at their allocated bedtime, try to forget the clock and interest them in something to engage their brain and senses to help promote the build-up of sleep pressure. If the weather is nice, a walk around the garden or down the street is an easy option, as there is so much more to engage a baby's senses outdoors than inside a static room with unchanging walls and ceilings. You could use what is called sensory nourishment. It's a strategy for helping babies to dial down. Boredom from staring at the ceiling can be easily misinterpreted by parents as tired cues. And you remember maybe that I have talked about babies' tired cues once upon a time. Maybe another thing that I need to repeat. And sometimes babies need sensory input rather than sleep. On the other hand, if your baby's sleep pressure is high and they are clearly ready to sleep but can't relax enough to achieve it, what in Western cultures might be called overtired, then they need help to dial down and remove the block that is preventing sleep onset, such as fear, anxiety, pain, excitement. In this situation, contact, comfort, and a calm, soothing environment may help some babies. Others respond to baby massage, to motion, or to being engaged in a quiet conversation. They may not respond verbally, but babies most definitely respond to being talked to directly and receiving your full attention. Try to stop and think about your own emotional and mental state when your baby is unsettled and can't unwind. Are they responding to your distress, frustration or distraction and trying to gain your attention and comfort? Could you put them in a sling or carrier and take them for a walk so you can both unwind a bit? Or ask someone else to do this while you do something relaxing for yourself? Or take yourself out of the picture for half an hour? And that's, I think, as far as I will be going tonight, because that's a lot already to digest. But yeah, I often suggest to mothers who may be at home with their baby all day that when their partner comes home to take over the baby, so that mum might be able to go and have a nice relaxing bath or maybe go for a walk around the block. And that dials down mum as well as maybe the baby. Anyway, again, it's a really nice book to read if you are up to it. It's now available in paperback, and also it is available as a book that you can just listen to. So yeah, so How Babies Sleep, beautifully written, some really good suggestions, and I hope that that gives you a little bit of food for thought for tonight. And I'll talk to you next Wednesday. Okay. So have a really good week, and wherever you are, all the very best. You can only be a good enough parent. So we all have to realize that we can't be perfect, and we have to find strategies, and we have to experiment with our babies because they're all so different. Okay. Bye for now.